right, good morning. I gave you an extra 5 minutes of your networking reception. So let's come on back to our seats and we can hear from our wonderful panel. I'm sorry, my throat's a little scratchy. It's what happens when remote employees come out of their hidey hole. We don't know how to be in the world. So I ended up with a bit of a sore throat. So bear with me this morning. So I'm really excited to introduce our illustrious panel today, and they're going to be telling you a little bit about the value they have seen return to them after participating in network studies like the LEGEND Type 2 Diabetes initiative we just heard from. But before I introduce them, I think I'd be remiss if I did not speak a little bit about the OHDSI Evidence Network and what we have been working on the past couple years. So, you know, we in OHDSI, we have maybe a fascination or a love for the ancient Greeks. And the ancient Greeks also had a special relationship with the night sky. And they would look up and see these multitudes of stars. Of course, they didn't have the light pollution that we have now. And they would begin to tell stories, and they would connect these stars into constellations. And I think that's exactly what we do here in OHDSI. There we go. So I really think this is very similar to what we do here in OHDSI, but instead of stars, we have data partners. And instead of constellations, we are connecting these data partners together, these data partners around the world, so we can make observations and generate evidence that are improving patient lives. Now, like I said, if you were here at the OHDSI Symposium last year, or if you've been on our community calls this year, you know that we are making a real concerted effort to formalize the OHDSI Evidence Network. And really what this is, it's a way for us to better connect people in the community who need data with people who have data. In the past, we've done this at a very grassroots OHDSI way, where you go on the forums and say, hey, I've got a network study. I'm really interested in learning something new. And people said, yeah, I'd like to participate. I've got data. But as we get bigger, and you saw our map of collaborators this morning, as we get bigger, that is not as an effective means of communication with everyone in the community. So we're really trying to formalize that effort. And over the last year or so, starting with the SOS Challenge, where we saw Cindy Kai receive an award for her wonderful work there. Yeah, Cindy. Starting with the SOS Challenge and moving into this year, we have really started to build up our network. So I'd really like to thank all of the stars in our network currently in our OHDSI galaxy. And I hope you see many familiar names up here, but also some new names. But like any galaxy, we know there are many stars yet undiscovered or uncharted. So I really hope that if you at your institution have data that has been mapped to the OMOP CDM and you've been inspired by what you've heard already, or maybe you're hesitant and you want to say, well, what's in it for me? That's what my panelists are here to tell you about today. But I hope you reflect on everything that you're learning today, and I hope you consider joining us in the OHDSI Evidence Network. All right, so with my shameless plug over, I would like to introduce our first panelist. This is Scott Duvall. He is the Director of Vinci at the United States Department of Veterans Affairs, aka the original VA OHDSI groupie, aka Patrick's biggest fan.
Thanks. Thanks, I'm happy to be here. My first time on the OHDSI stage, so it's a little nerve-wracking. There's legends, literally, in the audience, and to have the Department of Veterans Affairs be listed as a star is really meaningful. The Department of Veterans Affairs in the United States has a mission that was first given by President Abraham Lincoln. And the current mission is to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, and caregivers and survivors. So what I'm going to do right now is talk about how OHDSI has benefited VA and hopefully how VA has tried to benefit the OHDSI community as a whole. But I'm going to do it in a little bit of a different way so that you, no matter if you're here in the United States or if you're visiting from other countries around the world, I want you to kind of understand a little bit of our mindset. And so I'll walk you through some pieces that are related to the Department of Veterans Affairs. I want to start out, though, by saying that this journey for me is personal. I did not serve in the United States Armed Forces, but I come from a long line of people who did. Here is my father, who served in the Army Reserves, my grandfather, who served during World War II in the U.S. Army. Both my grandfathers both served in the U.S. Army during World War II. My great-uncle in the Marine Corps, and my great-grandfather in World War I. So these are folks who came home and received some care from the government. And so it feels good when I'm working to think that I'm working for an organization that has served my family in the past. Not just those that served in the military. We have a long history of working for the government in my family. And this is my grandmother, Joy Cummings. She's at the Naval Supply Depot here in a picture that was there. And it's noted that she was one of the employees of the month. And so this is something that means a lot to me. This middle picture here is my grandmother as a key punch operator in the tabulating unit in the Department of, at the time, the Veterans Administration building in Salt Lake City. So what we do here nowadays with our supercomputers and our cloud computing, my grandmother was one of the first computers to do this work. Because this is so personal to me, I thought what I'd do is I'd bring you along with me. And I'm going to take you, you might think I got special permission. I went to the president and got a signed letter that I could all induct you into this officer candidate school. But there was a long line, so I skipped it. This is totally unofficial. It doesn't mean anything. You don't get any special certificate at the end of this, but I thought I'd bring you along with the journey. In Officer Candidate Training School, what happens is you learn some of the core principles that you need to manage, in this case, the strategic reserves of the armed forces on how to deal in stressful situations, if it's combat or if it's logistical or many of the other things, engineering, some of the other things that the military is involved in. Now, to do this, I'm going to introduce a little bit more about the Department of Veterans Affairs. In the early 90s, I think, there was a slogan that they said as they were trying to recruit that said, "Be all that you can be, join the Army." And this is a new resurgence of that. And I'll tell you that I think the VA is the best place in the world to be and to work with our veterans. But I'm not going to say that. I'm going to let our friend from Harvard say that. This is Dr. Robert Green. Now, to clarify, he was invited by the VA to a VA-specific precision oncology meeting. Yet, these are the words that he said that I will proudly take out of context. He said, "The VA may be the only healthcare system that can answer long-term multidimensional risk." I like that. This is something that I wrote down, I went back and cited. And let me tell you a little bit why. So the Department of Veterans Affairs provides health care across the nation and in several other places throughout the world. Every place you see a dot, there's a community clinic. And every place you see a marker, there's a medical center. So these are some of the places that provide care across the United States. We've got about 17 million members who have had at least one visit in the Department of Veterans Affairs healthcare system. So this is just one piece of it, is a really diverse national healthcare system that provides service to our veterans. The next piece is we have an electronic medical record that has been around since the 90s. A lot of things that it did early on, including collecting notes, clinical text. These were important things. All this is gathered together in a data warehouse, and we make that available for research and other purposes in an environment called Vinci. VA has an active presence in precision medicine, and so there's more than, we've just crossed the 5 million mark for a number of tests that have been ordered through the process of clinical care. We also have the Million Veteran Program, which is something we're very proud of now that more than 1 million veterans have enrolled. Not only do they share their healthcare records, but in addition to clinical tests that they might get for molecular genetic diagnostic testing, they have a big panel of genetic tests that are done. So more than 1 million people participate in that. We have active collaborations with the Department of Defense where we link data and work together to share data with each other. And all of this data is transformed into the OMOP Common Data Model. We have linked claims that comes from the Centers for Medicare and Medicaid Service for all of our veterans. And so those are linked and brought in and transformed into the OMOP Common Data Model, as well as the National Death Index, the cause of death data that comes from the Centers for Disease Control and Prevention in the United States. So this is why I think the VA has a recipe for success in doing some of these types of studies. Now, our journey with OHDSI begins. And here in Officer Candidate School, the first thing I'm going to talk about is the communication skills that are necessary to become a good officer, right? It's clear. You got to command and make sure that that communication that you have goes through the right channels. So VA does have some of the most complex and comprehensive medical data in the world, for sure. We've had it for a long time, and it does a lot of good. But what that means is there's a huge learning curve for anybody who wants to come in and use the data. We've found that by adopting the OMOP Common Data Model, it greatly reduces that learning curve. And not only that, but because we build in the best practices for how to use VA data in all of its complexity into the OMOP Common Data Model, people using OMOP provide more reliable evidence than the general public who's using the complex data themselves. So for us, VA gets a benefit from OHDSI by adopting this standard data model. We love the standardized concept mappings, and we are so grateful for the vocabulary team. The Titan Award, again, is well deserved. We embed best practices based on all kinds of groups in VA that work on that, how to identify a single person across different data sources, how to link, how to deal with conflicting information. All that's embedded in our ETL algorithms. We combine data from multiple data sets. We link them on the back end, and we leave a breadcrumb so people can always go back to the source of any OMOP row and do additional work, or there might be parts of that record that weren't transformed in OMOP. There's a direct link there. So it's an additional option that we can use with any other data source. Now, you'll know that for officers, tactical and strategical planning is key. You might need to make some decisions on your feet, but you need to have a long-term plan and a long-term strategy. So how does that work with OHDSI? Well, some of the benefits that we've received from OHDSI come from the vision that OHDSI provides. Here, this is Patrick. It might be a pre-Catherine Patrick. So this might be a few years ago. But one of the things that stuck out from one of the early presentations that I heard was this question that what if you weren't bound by an 8.5 by 11 page or an A4 page, depending on which part of the world you're in. What if there was a more interactive way to look at the results and to use those results? And so that has been meaningful to us. In fact, we stopped developing some systems inside VA specifically so that we could adopt OHDSI tools. And one of our biggest deployments to date is a high throughput genome-wide association study system, a genetic analysis system that uses Atlas as its front end. So every cohort and every covariate that's defined comes through the Atlas system. We've had more than 9,000 GWASs run through that, and it's supported a various number of projects. I'll quickly state that the next piece is about decision making and critical thinking. That's the next skill you have as an officer. And the amount of innovation that comes from the methodology groups has really transformed the work that we do inside the VA. From large-scale propensity score modeling to using negative controls to calibrate our results, the different ways that we do sensitivity analysis, these have all made the evidence that comes from the VA more reliable. The last piece that I'll focus on is the team building and collaboration. That is a key skill for an officer. And so the way that we have benefited from this is we do have a dedicated team that works specifically on the OMOP Common Data Model transformation and working on OHDSI network studies and some of the tools related there. You might know that the changing demographic of the United States and the United States military in general has been drastic, where some of the previous wars were mostly men for the majority, and for a large part it was mostly white men. And so in the Department of Veterans Affairs, we've had a larger, older, more male, mostly white population. But the largest growing demographics for our population are younger, many more female. Almost 20% of all officers in the military now are female officers. And then a large number of other underserved populations, racial, ethnic, other types of populations there. So the data that we need to learn to better treat our veterans is not the data that we have. And we rely on the fantastic partnerships that we have in the OHDSI Evidence Network and other network studies that we've done to be able to try and find the best answers for us moving forward. We've had the opportunity to participate in several projects that are high profile and that make a difference. And we've got several ongoing projects with OHDSI now. So I'll leave you by saying congratulations, you're all inducted now into this fictitious OHDSI/VA officer candidate school, and we look forward to many more opportunities with you as we move forward. Thank you.
Well, thank you so much, Scott. That was wonderful. I definitely learned a lot. Next up, we have Talita Duarte-Salles. She is an assistant professor at Erasmus Medical Center, and she is also the lead in charge of the real-world epidemiology group at IDIAP Duarte-Salles.
Well, good morning, everyone. It's a real pleasure for me to be here today. This is my first, believe it or not, my first OHDSI Global Symposium. So it's a real honor to be able to give a presentation today. So thank you for having me. I would like to start very briefly just to explain what is IDIAP. There's a bit of confusion. What is IDIAP and SIDIAP? And I get it because, you know, these are very similar acronyms. So IDIAP at Duarte-Salles is the Foundation Institute for Primary Care Research, Duarte-Salles Igurina. It has more than 1,500 researchers, including a lot of healthcare professionals from primary care, and 35 research groups working in different areas, including real-world evidence. And it's located in the beautiful city of Barcelona in Spain. Oh, you cannot hear me? Sorry. Can you hear me now? You didn't hear anything, you said? Wow. All right. IDIAP is the institution with a lot of researchers and in the beautiful city of Barcelona. And before introducing you to SIDIAP, for those of you not familiar with Spain and the Spanish healthcare system. So Spain is located in the south of Europe, and it is divided in 17 autonomous communities, and the healthcare system is actually decentralized in those different regions. We have the luck to have a public health system free of charge, aside from medicines for which we have a co-payment system. And primary care centers are the first point of contact for accessing healthcare services, except for emergencies, which obviously would be hospitals. And SIDIAP is the information system for research in primary care. It includes data collected by more than 10,000 healthcare professionals from 328 primary care centers in Catalonia. It has data from more than 8 million people. Data is collected since 2006 and is updated on a 6-monthly basis. The mean follow-up time of the population in SIDIAP is more than 16 years. And it has been shown to be representative of the general population living in Catalonia in terms of geographic distribution, age, and sex. And what kind of data do we have? So we have information on demographics, so age, sex, nationality, socioeconomic status. We also have lifestyle factors that are recorded during primary care visits, so including smoking, alcohol intake, clinical measurements such as BMI, blood pressure, medical diagnosis, so everything, all the conditions are recorded in ICD-10-TM codes. And for medicines, we have information not only on prescriptions from primary care, but also dispensations into community pharmacies. We also have data on laboratory test results, sick leaves, including their cause and duration, and date of death. And SIDIAP can be linked to other external databases. It has been linked to disease registries. For example, we're able to link it to cancer registries to perform validation studies. We've managed to link SIDIAP to environmental exposures such as air pollution, green spaces, built environment, food environment, or daily temperatures. And SIDIAP is linked to public and private hospital discharge records. So everything that is recorded during hospitalization in terms of diagnosis and procedures. And we've also managed to link SIDIAP, to link mother and child pairs in SIDIAP with more than 700,000 pairs. And our journey in OHDSI and with OMOP started in 2015 with the IMI project called EMIF, and it continued with another IMI project called EDEN, that I'm sure that you're all familiar with. And thanks to that, in 2020, we had our first CDM release, and we were able to participate in many network studies on COVID-19 and, of course, generate evidence. These are just some of the studies that we were able to participate. And then I think this is the main reason why I'm here today, is to talk a little bit about the value of network studies for IDIAP Jordi as an institution and SIDIAP as a database. So the first one I would like to highlight is participating in these network studies have helped us to improve our knowledge about our own data. So understanding its strengths and limitations, which is very important to interpretation of results. This is also true for sure on the mapping exercise that we do, that it also helps us to understand better our data. It has also been very positive in terms of establishing new collaborations, and this is where I think, thanks to, for Mark, we had many calls in the afternoons looking into R and trying to fix issues that we had when we were participating in the COVID-19 network studies. I think thanks to that, we were then able to be involved in the LEGEND type 2 diabetes study. And this is quite obvious, but I thought it was important to say that also by participating in network studies, we're able to generate reliable evidence of high impact, reaching a broader public health impact with potential to improve patient outcome on larger scale, and also to accelerate research by reducing duplication of efforts and increasing efficiency. It has also been very important for us in terms of training and career development. So in training, thanks to our participation in network studies, we were able to also understand the standard analytic tools and see how we could also perform our own studies. And in terms of career development, so we had at the moment already 2 PhDs that were conducted using only data mapped to OMOP, and including some studies from the network studies in COVID-19. And of course, visibility. So it has helped us to earn trust, not only as a data partner, but also as a research group and as an institution. And in that way, I would like to highlight that we were one of the first data partners to be invited to participate in the Darwin EU Data Network in 2022. And for those not familiar with Darwin, so Darwin is a federated network of data, expertise, and services that supports better decision-making throughout the product lifecycle by generating reliable evidence from real-world healthcare data. It has a coordinating center that is Erasmus Medical Center, and we work directly with EMA with the requests for studies from EMA and their scientific committees. And in SIDIAP, we've been already able to participate, or we're still participating in a total of 33 studies. So 9 complex studies and 24 off-the-shelf studies, which are more simple studies. But just to highlight that we are one of the data partners that have been mostly used in the studies of Darwin. And if you're interested, you can check the Darwin website to see the complete list of studies that are being conducted at the moment. And where are we now? So now we are taking a step forward, and we're leading our first network study together with the Oncology Working Group on the characteristics, prevalence, incidence, and survival of cancer over time in the OHDSI network. So if you want to be part of that, please contact me or Irene Lopez from my team, who's going to be working on this. And thank you very much for your attention.
Hi, thank you so much, Talita. Next up, we have Atif Adam. He is the Associate Director of Real World Evidence and Epidemiology at IQVIA. Atif.
Can folks hear me now? Perfect. Maybe a bit too clearly. Something I need to tell people, I have a slight stutter, so if you see me zone out, it's not shock or epilepsy, it's just me taking time to think through. I'll try to go slowly and I'll try not to stutter, but it does come off sometimes awkwardly. So my role here is to follow up these great presenters talking about commercial and industry's role in OHDSI, and I really think of it as a real world, multiple sets of assets, or even multiple universes, just like Marvel has, right? Real world evidence, there's a universe that academia plays in, there's a real world universe that government regulators play in, there's a real world evidence universe that industry and commercial plays in. But they all overlap, and I believe OHDSI is the glue that brings all this together. What I tried to add in last night, but it didn't come through, was this really cool ChatGPT image. I'll send that over later. But the process that I wanted to kind of walk through is the growing scale of real-world evidence that's come out over the years in industry and the different use cases of real-world evidence. So if you really look at the trajectory, it started off with safety monitoring and post-marketing, and it slowly evolved to actually being key critical elements in your developmental pipelines. It's tapped into unmet market needs, changing regional variations, and really kind of help industry kind of build and what does it mean to go from clinical trial efficacy to real world effectiveness. And this is an important change in strategy, because right now it feels like real world evidence has become critical not only to understanding the implications of drugs and procedures in the real world, but also planning the outcomes of clinical trials in the upcoming times. So as we really think about how industry and IQVIA thinks about real-world evidence as a whole, a key thing to kind of understand is the key differences that come from clinical trial to real-world evidence needs. There's a change in types of data. Real-world evidence is extremely heterogeneous. And it's not all about data. There's different data management aspects that you need, data architectures to host, data privacy rules, even different types of roles and teams you need to handle real-world evidence within industry. This cross-functional collaboration that needs to be built out isn't something easy, especially when a large part of the industry has been purely focusing on the clinical trial space. So there'll obviously be skill gaps. There'll obviously be learnings that need to be increased in this space as we go forward as well. So that's where OHDSI comes in. And what I see OHDSI is not just a tool, it's not a CDM, it's almost an ecosystem of services, right? So you have the talent pipeline, you have everyone here in the crowd who are different stakeholders, we have Titan Award winners, and we have researchers who are really contributing to this ecosystem of services that we have in OHDSI. So this continual learning experience and talent pool allows industry, IQVIA, and commercial to really tap into understanding how can we expedite our growth of real-world evidence services internally. It also allows us to kind of tap into the best practices guidelines as well when it comes to data use, data access, and presenting results as well. With real-world evidence, I think sometimes it's one bad apple spoils the whole orchard. So when you have studies and results that don't seem to fit with what peer review looks like, I think that totally spoils the landscape for everyone. And that's where OHDSI really comes in, kind of establishing community-wide standards and guidelines that industry and ourselves can take on board and use that forward as we build evidence practices as we go forward. There's also the leadership role that OHDSI takes as well. So the fact that there is guidelines, there's stakeholders both from the government, from academia, from industry involved in OHDSI, it helps drive the best practice guidelines forward and as well to meet expected standards as they evolve over time. So from a leadership perspective, I think especially for IQVIA and industry, I think that in addition to the evolving landscape, what we really focus on is how do we enhance decision-making using some principles in OHDSI as well, both in terms of regulatory alignment, but also in terms of understanding the talent development and strategic foresight needed to move this space forward. I think the key benefit of collaborating with OHDSI is to be at the cutting edge of what real-world evidence should be and what real-world evidence pipeline should be moving towards. At the end of the day, it is a growing market space as well, and some of the things that Talita talked about in terms of network studies and the large ecosystem of services. The ecosystem services that OHDSI provides helps facilitate the connections between vendors like ourselves and research partners in the community as well. We work with the VA and other government organizations to understand best practices and to understand how to use the longitudinal data that VA has in making effective decision makings as well. It's also important for us to understand that heterogeneous data coming in doesn't lead to the same results. The results from the Eden network and VA network could mean the same thing, but they're obviously two different health systems, two different populations. Understanding and using that forward comes with experts in the room who can help guide those decisions as well. I think the key facilitator as we move forward is to use not only the data and the knowledge, but the experts in the room to help guide what the real-world evidence interpretations should look like for the larger community as a whole. And as we kind of think forward on the pool of resources, I think a critical element that collaborates industry, commercial, and OHDSI is really accelerating the pipeline, both in terms of the needs of things that have to happen as we go forward, as we bring in patient-reported outcome, as we bring in variable data, and some of the things that we're talking about in terms of the FHIR, OMOP conversions, and health equity as well. If there's a need coming up in the real-world evidence space, I think the OHDSI and industry together really can come together to kind of help drive, again, the best practices in this space. This idea of co-development of advanced tools and data sets is, again, something that really accelerates the fact that we have a global community here that we can tap into to really think about how those co-developmental tools that are open source could be used across the board as standards as well. So as I leave this session, I wanted to highlight, again, 4 important things that I think that we all touched across. Real-world evidence is really expanding not only from a clinical strategy, but also from a commercial strategy perspective. OHDSI really brings in specialized knowledge, leadership, and commitment that I think we can all use across all our different stakeholders' perspective. And OHDSI's role itself is not only really accelerating the CDM and the tools, but actually providing leadership and providing a credible, scalable, real-world evidence source. And our call to action should be really embracing real-world evidence, the strategic asset, not only for post-clinical trial development, but in all our patient decision-making as we go forward. Thank you again.
Thank you so much, Atif. And I just want to take a moment to thank our panelists. You know, one of the first questions we get from people who are new to Odyssey, who are not sure if they're ready to, you know, embark on the journey of mapping their data or engaging in network studies, you know, one of those first questions we get is, well, what value will I see return? How can this help me in my institution? Which I think is a very valid question. It takes a lot of time and effort and money to really, you know, get to a place where you can participate. But I think what we've heard from Scott and Talita and Atif is that there's so many more things that you get back from the community in so many different ways. And so I really want to appreciate you guys for sharing your experiences and your viewpoints on that.